Okay. Hello, 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 everybody. Happy Sunday. You know what Sunday means? It is, let's talk about nursing, the Sunday shift. So we get down, we sit down, we talk to each other, we have some conversations about what's happening in healthcare. What are some concerns you have? If you're a pre nursing student or pre healthcare student, like questions in regards to the T's, I mean, it literally could be anything. The whole reason that we do this live every single Sunday is just for us to have a chat, to have a little bit of a conversation with a nursing educator who has been around the block a time or two. So if this is your first time here, and you've never been here before, and you're like, what the heck is going on? My name is Nurse Cheung. I have been a registered nurse now for over 14 years. My background primarily is emergency medicine and critical care, but I've also done medical surgical, progressive care, pre-op, PACU, a little bit of OR, travel nursing, certain specialties. I did orthopedics. I mean, I've done a lot. I've also done healthcare administration. I've done nurse management. I've done nursing education. I've done corporate education. So I've got a little bit of a range of things that I've been involved in. So if you have questions about healthcare, if you have concerns or worries or anything like that, you want to talk about what's happening right now with the federal financial aid situation when it comes to graduate nurses, this is our time to sit down and talk about it. Whatever I can possibly give you in regards to advice, mentorship, answering your questions, this is going to be the live to do that. So welcome, welcome, welcome to the community. Super excited to have you all here. Let's get started. So hello, everybody. Hey, Bella. Thank you. Yes, this is our new shirt. It's actually available in the store. We had like a whole conversation. Oh my gosh, it's been like probably the last 2 weeks where we've had a lot of people doubting themselves, like a lot of people. So one of the things we always talk about is like, don't doubt yourself just because you're not good at the moment or that you feel like you're not good at the moment doesn't mean that you're not going to be good later on down the road. So some of the things that I wanted to do was to kind of give you a reminder. So this is actually available in our store. If you're interested, for my TikTok folks, I'll go ahead and pop up the message on your screen. You can talk to Mr. Cheung. He's sitting right next to me. But basically he says the power of yet. I can't do this yet. I'm not good at this yet. I don't understand this yet. It doesn't work yet. This doesn't make sense yet. Because at the end of the day, if you're struggling, we've all been there, right? Especially with me when I took my ATITs and nursing school, I struggled a lot with just like understanding things and feeling like I had to know everything. And you don't have to know everything. You don't have to know everything. You're just in your yet period. That's the power of yet. Hello, hello, hello. Hi, Noi. Hi, Ava. Some people say travel nursing gains more than a regular one. I don't know if that's even true. So when you say gains, I'm assuming you're talking about the monetary side. So will you get more money doing travel nursing? Yes, absolutely, 100%. But it depends on where you travel nurse to, right? At the end of the day. So for example, in Florida, you can see rates anywhere from like 1,500, maybe 2,000. Like they're not exorbitantly high, right? So then you have to take in cost of living. Cost of living in Florida has increased drastically in the last several years. If we're being fully transparent, if you're looking for like any kind of like short-term rentals, usually you're looking at like maybe $3,000 a month, just because of how expensive it's gotten. So basically, if you're making $1,500 a week, 2 weeks, you're basically just paying to live here. So to me, it doesn't make a whole lot of sense to do it in that situation. Whereas in California, right? California, you make way more than that when you think about it, right? You end up making maybe like $3,000 a week, maybe $4,000 or $5,000 a week. I don't know. It's just a little bit different in the variation. But here's the deal. Cost of living is extremely high over there too. So my biggest thing is like when you're trying to gauge whether an assignment is worth it when it comes to travel nursing, you really need to look into what is the cost of living, what is your gas going to be, transportation, groceries, and how much you're actually making to see if it's even worth doing. Here's the deal. There are going to be certain assignments that you're going to want to do just because of the location. right? Like we traveled all over the place when I was doing travel nursing just because I wanted to be someplace because they had some really cool things going on during that season. So sometimes the money might not outweigh the experience. So you may take an assignment where you're not taking as much just because you want to be in a certain location. So it's just everybody's like why is a little bit different as to why they want to do travel nursing, but you just have to kind of like take that in and figure that out for yourself. Starting my master's entry program soon. I'm an ex-elementary educator, hoping I can combine both. Absolutely. First of all, the fact that you're an ex-elementary educator is huge when you think about it in like the aspect of nursing. And I don't know specifically which master's you're going to do, but education like transcends all levels of everything, right? The more education you have, the more ability you have to teach other people, the better off you're going to be, and the better off you're going to learn when you think about it at the end of the day, because you figured that out through the process of teaching and how people learn and things like that. So I think you're going to be amazing. I think you're going to be just fine. I see some people taking their tea soon. You've got this. I'm trying to take my T's on the 19th, but I don't think I'm ready, especially reading. I'm currently focusing on science because every time I take a practice test, science is my lowest. First of all, you are not alone. If we're being fully transparent, you are not alone in that situation because science tends to be everybody's lowest when they are testing for the ATITs. And it's just because of the material. You have to know A and P, chemistry, life and physical science, and scientific reasoning. That's a wealth of information and only 50 questions on that test, right? It's just so much. So what I would say is take it one step at a time. Here's the deal. And I actually just recommended this to somebody today because they reached out to me. They said, is it better that I take my test now if I have the ability to do so, or should I wait closer to the deadline? Here's what I will say. If you have the availability to take it more than once, I do recognize certain schools will not let you take it so many times, but if you do have that flexibility, take it. The worst case scenario is that you were unsuccessful in a section, right? Or you're unsuccessful when it comes to the T's, but you've taken it, you've gained the experience, you know what the test is going to be like, and then that's going to put you light years ahead of so many other individuals. So failure isn't the end point, right? Being unsuccessful in the T's isn't the end point. It's just the new beginning, right? It's just where you know you need to go in order to continue on that journey. So just take that with you as you move forward. If you're really nervous about taking your T's, I think that's going to be a huge help. I usually never take notes on paper unless on my notebook or slides. Will this work in the ADN school? Oh, yeah. I never took notes on paper, to be fully transparent with y'all, when I was in nursing school, just because I type way faster than I can write. So I'm much quicker at typing than I am writing. So that was my whole thing, is I didn't want anything to do with pen and paper. I would print out my notes at the end of the day when I was studying, but typing them up and things like that, no, that went all on my computer. You're going to do just fine. Do whatever works best for you. I have a friend who has to take the ATITs for. What are the options to study for it? There's a lot of schools that are still using ATITs for. And here's the reason why. For some reason, when they released ATITs 4 to the schools, they released it with the ability that the schools could allow students to take the test over and over and over again without necessarily having to pay for it, like every single time. Every school had a little bit of a different policy, but they had the ability where the students didn't have to pay for it every single time. And they were able to take it as much as they wanted, because ATITs has this funky rule about 3 times in a year. So a lot of schools have stuck with ATITs 4. I don't have any specific resources in regards to that. I would say study as you generally would for the 7. It's only going to put you light years ahead when it comes to 4, since 4 wasn't as in depth as 7 is currently now. So the more knowledge you have, the easier the test will be. Do I have any material that will help me with the LVN program? Not yet. Haha, get it? Yet? The power of yet. It is something that I want to do. Can you work full time as a CNA and go to school full time as an LVN? That's a great question. Can you do it? Yes. Is it gonna be difficult? Yes. So, as long as you have a manager who is flexible with working with your school schedule, I think you're gonna be just fine. I think the problem we run into, especially me when I was in RN school and I was working as a patient care tech because obviously I wasn't certified. I was just in nursing school. I think the problem that we run into is that we have managers that'll be like, "No, you have to work this day," and something may come up, and then that's where it gets a little bit difficult. So the sooner that you have a conversation with your manager about what your plans are, I think honestly the better off you'll be. Gael, I stopped in to say that I passed the T's. Huge congrats. I know there's like a whole bunch of you in here that passed the ATITs. Big congratulations to all of you. Do you have any kids? Nervous about our toddler in a two-nurse household? Oh, yeah. We don't have any kids personally, unless you count our dogs, which personally I count the dogs. But is it going to be a little bit difficult with having, especially smaller children, that they don't really understand that, mommy needs to spend a lot of time focusing on this? Will that be difficult? Yes. So if you have like familial support, friend support, like somebody that can help just like for like periods of time where you can really like get into studying sections and that you're going to be uninterrupted, I think the better off you'll be. If you don't have support, but you have the monetary backing, then I would say maybe like daycare or like temporary childcare just for certain periods during the week, something like that, just to help you as much as possible. I think that's going to be the biggest thing that I can say. What's good study tips for nursing students who's in an online accelerated program? My biggest thing for you is going to be time management because number one, you're not only in a program that's online, right? Online, I don't, unless you've already done like your LPN or you've done like an associate's and you're doing some kind of accelerated program that way. I don't particularly like online nursing schools. That's the biggest thing. I think that you need a mirage of support when it comes to nursing school, but if you already have previous healthcare experience, then I most likely you'll be fine. Um, Big thing is going to be time management when it comes to online nursing schools, especially accelerated nursing programs. You're really going to have to stay on top of things because you can get behind so fast. It's not even funny how fast you can get behind. Number one. And then study tips. My biggest study tips that I always tell everybody, especially when it comes to nursing, study the front of the chapter where it goes over what the chapter is about. Go to the back of the chapter, see what like the summary, the key points that they're trying to make in the chapter are. And then look for any like boxes, bolded words, things like that in the main area. Don't try to read the entire chapter. If you're like me and you have ADHD and you can't process information like that, my biggest recommendation to you is don't read the entire chapter. It's not going to help. Look online. There's a ton of nursing school videos and things that are online. I think honestly that'll be more helpful for you than anything else, but really time management, organization, and then studying just the important things is going to be huge, especially in an accelerated program. Do we still have discounts for the study guides? We do. If you're interested, the discounts are automatically applied at your cart. So make sure that when you put the study guides in your cart, you'll see the discounts there. But I dropped for my TikTok folks a link at the bottom of the screen if you're interested in the sweatshirts that we have or the study materials when it comes to ATITs. And then everybody else, Mr. Cheung will drop that information for you. Do I think LPN is worth it or should I go straight into RN? I think LPN or RN are both fantastic careers. I don't think that there's anything wrong if somebody wants to be an LPN. I don't think there's anything wrong if somebody wants to be an RN at the end of the day. I do want to say though, if being an RN is your ultimate goal, just do RN. And the only reason why I say that is because one, you're saving yourself from having to take the T's twice. Yes, you heard that correctly. If you do LPN first and then decide to do RN later, you will have to take the ATITs again. I had somebody recently reach out to me and they said that they didn't know that they were going to have to take the T's again. And the whole reason they did LPN the first time was because they couldn't get the T score. And they thought that by taking the LPN route and then applying for nursing school, they would skip the T's. Doesn't work that way. Doesn't work that way. So yes, you will have to take the ATITs more than once. So if you want to be an RN at the end of the day, I say do RN. If you don't have the monetary ability to do RN now, or maybe like time commitments in regards to work schedules and things like that, then I would say do LPN first, get your feet wet with LPN, and then come back and do RN. But it's really just completely up to you. Completely up to you what works best for you and what you've got going on in your life currently. Night shift is the best to work and attend school full time. You have to rest after you come home. Yeah, that's the whole thing. So here's the deal. I worked night shift when I was in nursing school. So after my first semester, I had the ability to start working as a patient care technician. And when I did that, I worked night shift on an oncology unit, inpatient oncology. And I did it full time, and it was not good. I had a manager that was not flexible with my schedule. So I was basically going to school during the day, coming home and taking maybe a 2-hour nap, and then going to work for a 12-hour shift, going straight to my classes, and then coming home again to do another couple hours nap before I went back to my next shift. I don't recommend that situation. If you want to work night shift, I would say look for a per diem job, because then you get to pick your schedule. They don't tell you what you're going to work. That would be my biggest recommendation with working while you're in nursing school. The more like flexibility you have with your schedule, the better off your mental health will be. Trust me. Trust me. Nurse Cheung, your materials are so concise. You explain the materials deeply. Good. That was the whole thing when we were doing the updates for ATIT's material, is that not that the guys weren't already really good, but we wanted to make them even better. So we wanted the explanations to be better, the breakdowns of concepts to be better, just like a better overall guide of what people were saying worked for them, what didn't work for them, just to make it as good as possible. So the more that you all reach out to us and give us feedback about things, the better we can make the guides for everybody in the future. I did LPN wanting to bridge to RN, but loved LPN and been an LPN for 25 years now. And hey, and like I said, there's nothing wrong with that, right? So a lot of people will be like, oh, I'll just do LPN now. I'll get my feet a little bit wet and then I'll go back and do RN later. But then you like get into it. And if you find a really good job or you find like a really good specialty, you may not want to go back for RN. And there's nothing wrong with that, right? There's nothing wrong with that at all. At the end of the day, we're all nurses. We just have a little bit of a different scope of practice. That's the only thing that separates us. Aw, thanks, Samira. I appreciate it. I would rather suffer one time with T's because I'm not learning T's 22 or whatever comes out next. Just my opinion. And that's the thing, Noah. That's what I'm saying. At the end of the day, if you want to be an RN and that's your end goal and you're trying to decide, just do it, right? Just try your best and get that score that you need for the RN. There's nothing wrong with that whatsoever. I remember you. Who? Oh no, my team. Jahalex? Yeah, Jahalex. Hey, don't know if you remember me, but guess what? I take my Fundles Fundamental tomorrow. I'm almost done with level 1. Of course I remember you. That's awesome. Can you believe? I mean, I can't believe it's December, the end of December almost. Yeah, I know. Isn't that crazy? I know. Good thing is, the bad thing is, I don't think she changed. I should change her picture a little bit, but it's still a chicken. Yeah, it's still the chicken. We'll always remember the chicken. Can you pin the message on how to get materials? Yeah. So for my TikTok folks who are asking about how to get the study guides, I'm just going to pin a little message at the bottom of your screen. You can click on that. Mr. Cheung can help answer any and all questions you have in regards to study material, videos, freebies. I mean, there's all kinds of stuff that we have when it comes to ATITs. I love your channel. Thanks for being a superhero without a cape. Aw, thanks, Dimple. I already have a degree. Would you recommend BS or two BSN program, or should I do the RN program? Ooh, great question. I think that either one of them would be good since you already have your degree. I think that whichever one goes a little bit slowest is my thing. Here's the deal. Nursing school is really hard. Really hard. So the less accelerated you can be, the better in my personal opinion. I know that a lot of people like to move at a fast pace. I get that. But I think that the more time that you can give yourself to really learn concepts and understand why things are happening and why things are the way that they are, I think the better off you will be. So either option is a good option. Just pick honestly the one that works best for you and the time commitments and the things that you're going to have to do while you're in the program, meeting the expectations that you need for the program. All the guides are awesome. I love them. Everything is helpful and detailed. Practice questions and the rationales are the best. Oh, thanks, Lisa. I appreciate you. I'm glad that you love them. I work so hard. So hard. That's why I love it. Yeah, by the way, it's chicken nuggets. I know that's exactly this. It was the picture. It was the picture that changed, or that was the same. That's why we knew who it was. Yeah. Chicken nuggies.
See, we remember every single one.
We remember so many of y'all. So many. Can I be a hospice nurse as an LPN? There are some hospice nurses in LPN roles, or I should say LPNs in hospice nurse roles. I think that it's really depending on the state and your scope of practice, because one of the things, particularly in Florida, that LPNs cannot do is push IV medications. And one of the things that we do quite extensively in like end of life and hospice care is a lot of like IV medications for pain management, anti-anxiety, like things like that, to help as that person passes over to the other side. So I think that might be a little bit more difficult with LPN roles in hospice, but there's absolutely LPNs in hospice. They just do a little bit different. I think they do more of like the holistic side of nursing, whereas RNs do more of like the medication side in addition to the holistics as well.
What do you think about radiology compared to nursing?
I don't think there's anything wrong with either one. So the question was, what do I think about nursing in comparison to radiology? The only thing is I think they're both fantastic. If you want to do radiology, 100% go for it. We always need good radiology techs when it comes to healthcare. But if you're wanting to really grow and expand your career, then I would say go the nursing route. Radiology, you can expand so much and you can expand so much out. Do you know what I'm saying? As opposed to nursing, there's like endless expansions out and endless expansions up. I mean, there's just so much. So if you're really wanting to get into the money side of healthcare, I would say nursing is probably going to be the best bet. If you're good with like the limited patient interaction, radiology still pays well as well, 100%. But if you're wanting the more like less patient interaction, more work-life balance, I know that sounds horrible, but like more work-life balance and things like that, then I would say go the radiology route. Just know that there is going to be a peak at some point where you can no longer progress up. You'd have to look for other opportunities out, if that makes sense. Still waiting to find out if I got accepted into my associate RN program. Should I look into other schools while I wait? There's nothing wrong with looking into other schools. Here's the deal. When I applied for nursing, I applied for several different schools. I didn't put my bucket all on one hat, right? I wanted to make sure that if my key school that I really wanted to go to did not accept me, that I would still be in a good position with other schools or maybe other acceptances. So I actually applied to several schools and got very fortunate that my key school did accept me. But hey, I had a backup plan. I have backups to my backups to my backups just in case. So there's nothing wrong with applying to other programs. If we took the NCLEX and passed after the ADN program, do we have to take it again doing BSN? No. So if you were in a ADN RN program, RN, program and you were going back to school to get your bachelor's degree, you do not have to take the NCLEX again. You also don't even have to take any like pre-nursing stuff again, if we're being fully transparent. If you, however, did LPN and you took the NCLEX PN and then wanted to go back to school to do RN, then yes, you would have to take the NCLEX again. That time you would take the NCLEX RN. NCLEX RN. Can't believe I've been here for a year. Isn't that crazy? And I made it to nursing school. Definitely couldn't do it without you. You're amazing, chicken nuggies. How hard is a tease, in my opinion, on a scale of 1 to 10? That's a great question. I think it's very subjective, but in my personal opinion, I think that the tease is probably, I want to say like an 8. The tease is not easy, y'all. If we're being fully transparent, the tease is not easy and it's not meant to be easy, right? Like we had this conversation, I don't know how long ago it was, but if tease was easy, everybody would be doing it, right? Every person you could think about possibly would be passing the ATITs. And can you imagine how difficult it would be to apply for your nursing school or radiology program or sonography, whatever it is that you're doing? Can you imagine how difficult it would be if everybody passed it? So that's why I keep trying to explain to people is that if you pass the ATITs, you're like part of the top 10% of individuals who are passing this test because it's not an easy test. You're not only having to learn reading and English, which in and of themselves is a complete bore for being completely transparent, but you're also having to learn math, which is a lot of conversions. It's a lot of equations. It's a lot of just breakdown of things that we probably haven't touched in a long time. And then science. Science is the biggest section. It's only 50 questions. It's only 5 more questions than reading, but it's covering so much. A&P, chemistry, life and physical science, scientific reasoning. It's ridiculous how many things you have to learn for 50 questions. So is the ATITs easy? Absolutely not, right? But if everybody was passing it and it was easy, imagine how competitive schools would be and how depressing that would be. You know what I'm saying? So if you're studying and if you're passing, even if you have like the minimum, you're still better than 10%. You're at the top 10%, right? You're beating the other 90. That's something to celebrate. How do you feel about getting a nursing degree online? I don't like it. I'm going to be fully transparent. A lot of these online nursing schools, and I'm talking about like your initial nursing. I'm not talking about like going back to school to do your BSN. I'm not talking about doing like your master's in nursing education or whatever online. Those aren't the schools I'm talking about. I'm talking about your initial education, your initial BSN, your initial associate's degrees. There's a lot of schools that are popping up that are online nursing colleges, and they're not necessarily nationally accredited. So they're not meeting the CCNE or the ACEN national accreditation when it comes to nursing colleges. And when that happens, if you wanted to go back to school later, it's going to be a little bit more difficult because a lot of credits and things won't transfer over into your new school if you're wanting to accelerate your education at a different point in time. So I'm not a huge fan of online nursing schools for initial nursing education. That's just my personal opinion. I feel like if you're going back to school, sure, cool. But not initially. That's just me. I passed my T's on Friday. Thanks to your videos and trivia came in handy this morning. You are absolutely welcome. Much grace. That's amazing. Huge congrats.
So someone asked, how to study as a procrastinator for the T's?
Here's the deal, y'all. I was watching this, it was a reel. I don't remember where I was watching it. But I was watching this reel and it kind of like hit me because I am the biggest procrastinator there is. And when I procrastinate, what do? You go look for motivation, right? Like you're like, I'm going to go online and I'm going to look up like motivational songs, or I'm going to look up like how to motivate myself because I'm a procrastinator. I had to find something to get me there. But here's the deal. This is what procrastination does. Procrastination is costly, disobedience is expensive. Meaning that the more that you procrastinate, the more expensive it is going to become. And without having discipline, things are going to be expensive, right? So procrastination is costly, meaning that if you keep putting off studying for something, whether it's a test, ATITs, studying for an exam that's coming up, that's costly. And without having the discipline in place that you need in order to be successful, that's going to be real expensive because what's going to happen? You're either going to be unsuccessful with the T's because you didn't spend a whole lot of time studying, or you might not pass that class in nursing school. Because remember, specifically in nursing school, it only takes one test. If you just like completely fail that one test can make or break you. Because remember, nursing school passing is not the typical like 70 to 100 scale like we see with our prerequisites. It could be like 84 to 100. That's how bad nursing school is. Like 84 could be a C, not a B. It could be a C. So procrastination is costly, disobedience is expensive at the end of the day. Like you've got to figure out how to stop that, right? Because here's the deal. Nothing is going to stop a person who is hungry for a better life. So when we tend to procrastinate, it's because we're just not in the mood to do it, right? Or other things are happening around us and we just put it off. But if you're really hungry for this career, if you're really hungry to be a better version of you at the end of the day, and to make more money, have better job security, have better career options, nothing's going to stop you. But if you're the type of person that's like, I don't want to do this, I'm not sure if this is really for me. If you keep telling yourself that narrative, then it's not, right? So that's why it's really, really important that you forget your mood. You forget about procrastinating. You just forget how you feel and follow the plan, right? The more that you do this, the more better off you will be. I don't have the keys of the kingdom to tell somebody how to stop procrastinating. I just don't. But I can tell you that if you stop procrastinating, doors are going to open up for you. And it's going to be endless. There's going to be light at the end of that tunnel, but you've got to put yourself there and you've got to get there, you know? So that's the whole thing.
Can you shout out a shirt? Someone say, I need your shirt so bad.
Somebody said they need my shirt so bad. We are actually selling this in the store. So if you're interested, Mr. Cheung also has a shirt that he wants to come over and show. But we have it's okay to make mistakes. It's okay to not be okay. It's okay to have hard days. Be yourself, not know it all, start over, and need more time. So we've got things that are brewing. This is just like our motivation to you that, hey, keep going, right? But it's available in the store. So if you're interested for my TikTok folks, I'm going to pop that up on your screen. There you go. You can message Mr. Cheung. He can tell you specifically where it's at. But yeah, we literally have this conversation every single time we go live. So we said, we're going to throw it on a sweatshirt.
And it's embroidery.
It's embroidery, so it's not print. This is like actual, like, it's stitched on. It's good quality. And we've got the really good sweaters. Not the crappy itchy sweaters that make you want to like rip your skin off. Like these are nice. Like I'm not wearing a shirt under here. Not that you want to see that, but it's because it's that comfortable. You don't need it. No way. Is delayed but not denied there? We probably should have created that. Yeah.
We'll make it happen.
We'll make it happen.
I need to make sure if it's stitched. I need to make sure I measure it right.
It's like a whole thing when it comes to embroidery. Mr. Cheung spent a lot of time on it's like a whole thing. I don't know. I don't understand it. I do healthcare. I know like how to like give patients medication to fix things. Like I know that piece of healthcare. I don't know.
And members, make sure you use your discount.
Yeah, and if you're part of the memberships, you can use your discounts, y'all. You've got discount options. If I didn't pass this semester, should I go back again the next one or just take a break for now? That's really up to you. So everybody's a little bit different, right? Everybody handles being unsuccessful in different ways. So this is what I would say. For me, I'd keep going. Because ain't nothing stopping me from reaching my goals at the end of the day. Like, ain't nobody gonna tell me. I had an instructor, not an instructor, it was a counselor in nursing school. Tell me specifically, she was like, you need to drop out now because you're not gonna make it. And I said, you're not gonna tell me what I'm gonna do. I'm gonna make it. And I did. I ended up finishing the class with a C. But at the end of the day, nobody's gonna tell me what to do. So, me personally, I keep going because the more that I wait around, the more my life is going away. Right? In our lifetime, we only have 75 years. If we're lucky, we have 75 years. That's 75 winters, springs, summers, and falls. That's it. So when you look at it as a whole, it's not a whole lot of time, right? So that's why I say get your head in the game, get back on that horse, get back to what's important right now. Don't wait, and keep pushing forward. Forget your mood, follow the plan. You're going to do amazing. You just hit a rough spot, and that's okay. There's nothing wrong with that. Oh, Mr. Cheung's PJ pants. Yeah, he has a Star Wars PJ pants.
Hey,
Matches the colors of the shirt.
Business.
Business on top, play casual on the bottom.
Yeah.
Hi, Nurse Cheung. Thanks to you got an 80% on my teas and got into nursing school. That's awesome, Jalen. I'm so proud of you. That's great. Do you think I should go get my BSN or ASN? I'm currently at community college getting my prereqs. Here's the deal. I get this question a lot. Should I get my ASN now? Should I get my BSN now? I personally did a concurrent program. What I did my associates and my bachelor's at the exact same time. Completely up to you. If you have that option, I say take it. But here's the deal. An associate's degree still makes you a nurse. At the end of the day, you don't have to get your bachelor's immediately if you don't want to, because that's a big difference. That's 2 years of schooling versus 4. So if you just wanted to get your associates now and then maybe go back to do your bachelor's later, that's cool. Like there's nothing wrong with that. If you want to do your bachelor's now and you want to take those full 4 years, you can do that too. But you don't have to have your BSN initially in order to become a nurse. That's my biggest thing. What do I think about LPN programs? I don't think there's anything wrong with LPN programs. I think they're great. Here's the deal. At the end of the day, we're all nurses, right? Whether you're an LPN, whether you're an RN, it's just that our scope of practice looks different, right? It's just our scope of practice looks different. That's all it is at the end of the day. But there's nothing wrong with wanting to do LPN or wanting to do RN. They're both good options depending on what you want to do. I had an advisor tell me not to apply for the next semester. I'm applying next semester. And let me tell you something. Misery loves company. When you have got an advisor that is just miserable and they want to see other people miserable and they just don't have realistic expectations, they're going to put you down because they want you to be on their level. We're not on their level, right? At the end of the day, like we are above and going above and beyond our wildest dreams and the things that we want to do. So if you've got an advisor that's basically telling you, no, I wouldn't do it. No, I'm going to do it. Like, come on, like get it together. I don't need you to validate who I am. What's your favorite specialty so far? I'm currently my BSN track and I want to do either NP or CRNA. So me personally, I have my master's education, my master's of science in nursing education. That's what I've done. NP and CRNA are two very different careers, right? Nurse practitioner is you're working on alongside a provider, either an MD or a DO, and you're kind of like getting advice. Depends on your state, of course, but you're getting advice from them, caring for patients, kind of like you would as like a PA or something like that. You're just in the nursing route as opposed to the medical route. So there's that. And then CRNA is you're working with like anesthesiology. You're doing a lot of like surgeries and making sure that they're safe while they're, in this induced coma per se, while they're getting these procedures done, things like that. So they're both fantastic careers. There's nothing wrong with either one. But what I will tell you is I've never seen a happy NP. Let me say that one more time. I've never seen a happy nurse practitioner. I just haven't. When I went to school, I went back to school to be a nurse practitioner before I decided to do nursing education. And every time I would do a clinical with somebody, they were extremely like stressed out, burned out, not happy with their role, just like not having it. But in my time in the OR working with nurse anesthetists, right? I never once met somebody who wasn't happy. Maybe they just had like a bad day, but it wasn't that they were stressed out or unhappy. So take that as you would want to. But that's just been my personal experience with either one of those particular careers. What do you guys think about not considering nursing as a professional degree anymore? It's annoying me, especially because it'll affect my loans. Let's talk about it. Let's talk about the elephant in the room. Let's talk about financial aid when it comes to nursing and the classification of professional. So here's the deal, y'all. Nursing was never classified as a professional degree. I'm going to say that one more time. Nursing, our career, has never been classified as professional. We just haven't. Does it irritate me that all of the news outlets are basically saying like nurses aren't professional anymore? Yes, it irritates the bejesus out of me because we are a professional major. We are a profession, but they're making it seem like we were a professional degree and now we no longer are. So that number one irritates me. Okay. It's the way that the media is portraying it is what's PISSING me off, right? So that's number one. Number two is I'm very angry that this Big Beautiful Bill Act, which was released, has now taken graduate nurses out of receiving professional money because we are one of the few careers where it's almost impossible, especially when you're doing NP or doing, can't even do it with CRNA, is you can't work while you're in the program, right? You cannot work while you're in the program. So you rely on that federal funding in order to fund not only your tuition, but also your books, any kind of like additional equipment that you need, your living expenses, just everything. That's why it's so important that nursing is still considered part of those higher financial limits because we absolutely need those in order to progress our career. So am I irritated about it? Absolutely, 110%. Here's something that's not being talked about that's really important. Can you pick him up, please? Yeah. The dog is like losing his mind, and Mr. Cheung's just letting him lose his mind and make me lose my mind. So here's the thing that irritates me that people aren't talking about. So with these new limits, right, every year nursing is only limited to $20,500 a year and a lifetime max of $100,000. If you go to ASN, BSN, and you use your federal financial aid in order to fund you to go through those programs, those monies that you spent in school also count towards the $100,000 limit. Nobody's talking about this. I just found this out. So, for example, if you do like a bachelor's degree and your bachelor's degree costs you $30,000, That means you're only left with $70,000 to pay for your more advanced degree, right? That's it. You're only left with 70 grand. So if you're deciding to go back to school for like NP, that's going to be a little bit rough. You're probably going to have to put a little money out of pocket with that. But if you're going back to school for CRNA, then that puts us nurses in a really complicated situation because what happens? Now I have to pay with private loans for a program where I physically can't work because of the demanding schedule it requires in order to be in this program. It's very frustrating because a lot of nurses are going to now start turning to private loans, which are not good, y'all. The percentages that you have to pay for private loans are really bad. And there's not like a deferment like you get with financial aid loans in order to help fund your program, right? Where you get deferred like 6 months after you finish before you have to start paying them back. So it's a little irritating that the media is making it seem that we are not professionals. We are professionals. Nothing about what we do and how we do our job changes. It just changes how much the government is willing to give us in financial aid in order to reach those goals. So yeah, I'm a little irritated about it. And I didn't realize that with your undergraduate degree, if you take financial aid, that also counts towards your limit. Honestly, I foresee this like pushing the profession back. So if you're not wanting to advance your degree and you're just wanting to work the bedside or do whatever it is that you want to do, you're good. You're good, right? It's really for the people who are wanting to go back. You might want to start saving up because those grad plus loans like we used to get to help with living expenses and those additional things are no longer available to us. Specifically in the graduate programs. This doesn't affect if you're doing like your associates or if you're doing like your bachelor's degree, doesn't affect those. Those are undergraduate. It's more of the graduate programs because those are the ones that are really expensive. My plan was CRNA, but I feel like now I can't even dream about it. And here's the deal. I'm really hoping that it changes. I'm really hoping that with how much like we're talking about it and having conversations about it, maybe these people will get their head in the game to realize like how important nursing is to healthcare. Because I think at the end of the day, like our profession kind of gets crapped on a lot. Nursing is like, they kind of treat us like bottom of the barrel, but they couldn't run the system without us. And I think that's the problem. I don't think that people realize how much power we have when it comes to the profession. Like healthcare just wouldn't exist. You're not going to see doctors taking care of patients the way that nurses do. So I don't know. I'm really hoping that something changes. Hopefully by the time a lot of you are making a decision to go to school to get those more advanced degrees. But it doesn't take place until July of next year. So if anybody's trying to get into those programs now, you're still fine. You'll still be protected under the original financial aid guidelines. So yeah, that's my 2 cents on it. What's your opinion about new grad RNs in the ER? I think it's great. Here's the deal. There's certain professions, I was going to name a number, but there's a lot of them. There's certain professions that it doesn't make sense for you to start anywhere else unless you're just doing those jobs. Meaning that if you're wanting to be an RN in the ER, you might as well just do it because if you work on a unit, say med surg is not going to teach you a whole lot about being an ER nurse, right? It's just not. Inpatient and emergency medicine are 2 completely different things. When I left ER to do CVICU, I was like a fish out of the water because I had no clue what I was doing in inpatient because I was an ER nurse for so long. So ER, OR, labor and delivery, NICU. eh, I'm just going to stick with the three. ER, labor and delivery. Those are kind of like the ones that you've got to be in it, right? In order to actually really be able to do it. There's nothing that's really going to prepare you getting into those careers. I took out ICU because like even like step down will teach you quite a bit. Of like how to do generalized patient care until you get to the ICU. So I mean, but if you're wanting to do ER, I was a baby nurse in the ER. I had no clue what I was doing and I did it and it was fantastic. So I highly recommend it if that's something that you want to do.
Miranda asked, do you recommend a 2-year ASN accelerated? How accelerated is it compared to just getting the BSN?
It's extremely accelerated. Anytime a school says accelerated, it means that you are doing a lot of things in a short period of time. So, what would take nurses typically maybe 2 years, you're doing in like a year to maybe 18 months. So, you're doing things at a much faster rate than the typical traditional programs would. So, that's why I'm not a huge fan of accelerated programs unless you're doing like an LPN to RN bridge acceleration because you've already technically been working as an LPN and got that experience. But as like a new nurse wanting to go to school and do an accelerated program, I'm just not a huge fan of them because it's just like you're putting yourself at a disadvantage because you're not giving yourself enough time to learn the information but also retain it, right? Because you're just basically going boom 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 through the accelerated program. So I'm not a huge fan. And I don't like online. Do not like online. Not a huge fan. Online, fantastic if you're going back and wanting to do your BSN later or something like that. Cool. 100% down. But initial learning and trying to do stuff online, nah.
How long do you recommend the time frame from LPN to RN bridge as far as working after graduating?
I'd say like give yourself 6 months. Here's the deal. If you're ultimately doing the LPN route to do the RN route, there's nothing wrong with that. It's just, I always say, like, get your feet wet a little bit in LPN if you can. There are individuals who have gone the LPN route and then immediately went into the RN route after finishing LPN. I think that in those situations, I'm not a huge fan of that personally, just because of the fact that if your ultimate goal was to be an RN anyways, and you're doing it immediately afterwards, then you just took a seat from somebody who maybe really wanted to just be an LPN, right? They just really wanted to go to school and now they have to wait another semester or maybe wait another year to get into the program. Um that's the whole thing. So that's why like if you're going to do it, there's nothing I can say to stop you, right? But I would say, work a little bit as an LPN, just like see the career, see the options that are available to you, and then kind of do that. But if you're just wanting to do LPN to go to RN immediately, you can do that too. Just not a huge fan of it, that's all. If one likes psych and CRNA, how can they incorporate both career wise? Is there a role that supports both of these? Can a CRNA legally take a psych assignment on the side? So here's the deal. When you become a CRNA, that doesn't mean you lose your RN license. So there's been a considerable amount of people who went back to school to do NP, but still worked bedside as nursing because what they ended up finding out is that nursing was paying them more than if they were doing NP. Not everybody, but there was some people who went to school and then realized, oh, I get paid more money to be a nurse than I do to be an NP, and then they ended up just staying in the RN role. So, is there something you can incorporate psych and CRNA together? Not to my knowledge. I'm not 100% certain. I don't want to say no, but I just don't know, and that's okay. That's okay not to know. But can you be a CRNA and pick up RN psych assignments? I don't think that there's anything wrong with that. I think that people do that all the time, just from my personal experience, from what I've seen. Yeah, seasoned nurse pay is greater than new NP. Yeah, if you are going into NP thinking that initially you're going to be making bank, I hate to give you a rude awakening, you're not. NP roles in the beginning, just like anything, like even when you're a new graduate nurse, you're not going to get paid a whole lot, right? Because they have to invest in you and pay a lot of money to get you up to speed to where they need you to be. So that's why your pay isn't as high initially because you're having to relearn everything. You're having to learn a different side of things. So they're taking that investment back of the amount of money they're going to have to pay to teach you by lowering your pay initially. So over time, will you get more money as an MP? At some point you will, but not initially. And I think that's the problem is that a lot of nurses, seasoned nurses especially, were making maybe, I don't know, let's just say $47 an hour. I'm just coming up with a number. And then they go to school being an MP, they finish, and then they get offered like 40. That's a hard pill to swallow sometimes. So just take that into consideration when you're wanting to advance your degrees is that sometimes initially you're going to get paid less due to the training and things that they're going to have to give you in order to get you to where you need to be. Yeah, if you were wanting to do psych and like something else that was involved with psych, then I would say doing like mental health, nurse practitioner. That might be like a better type of thing. But I just wouldn't work in the same facility that you are doing nurse practitioner in and doing like an NP role. I'm sorry, doing an NP role and doing an RN role because you don't want the patients to get confused about what you are. So that situation I would say is like if you wanted to do an RN role, work in a different hospital, then you work as an NP. Just because I worked with mental health for a long time, especially in the ED, and have seen like providers struggle when they come out of school to try to switch that role. Sometimes it's a little bit difficult. What certifications do I need to be a psych nurse? I'm sure there is one. Let me see. Let me see. So they do have a psychiatric mental health nursing certification, which is a PMHBC. BC just means board certified, but they do have it. It's through the American Nurses Credentialing Center. But to be honest, you don't need that in order to be a psych nurse. It's just to show that you have the mental capability that is required in order to be like a top tier psych nurse, right? So usually you have to be a psych nurse for a period of time before you can actually take the exam. So once you take it and you pass it, then it's like, oh, okay, so this person really understands like mental health. That's kind of like what it is. Do you think it's okay to get your ADN first to get your RN and then your BSN while working? Absolutely. Here's the deal. And I advocate for this all the time. Is like, why pay for additional education when your employer will pay for it for you, right? So there's nothing wrong with going to school to do your associates and paying for that yourself. I mean, unless you're working as like a CNA and they help pay for that in your CNA role, but there's nothing wrong with going to school, paying for your associates, and then going back to school once you get a job and doing your bachelor's degree and having your work pay for it. The only caveat I will say in regards to that is to read the fine print when your employer pays for your bachelor's degree, because some employers will flip the script and say, "Oh, well, we're going to pay for your bachelor's degree, but you're going to have to work for us for 2 years after we pay for it." And some of y'all don't want to do that. And that's okay. But just know that if you leave after they've paid for it and go someplace else, they will come after you for that money. Especially now. Back when I was working in administration, prior to becoming a nurse, they didn't really go after people. They were kind of like, oh, it is what it is. You know, we're good. But now hospitals are coming after you for everything. Right now, hospitals are suing nurses left and right in certain situations. So that's why, like, don't think that they're not going to come after you, because they will come after you, especially now. The climate is very different now in healthcare than it used to be. Exactly why I won't go that route. Yeah, it's let me tell y'all, when I started healthcare 14 years ago,
Ew.
it is a very different place than it is now. A very different place. It's crazy. I've been studying and now I have 2 more weeks until the exam. What do I do? I'm trying to study, but I keep getting distracted. Get rid of the distractions. That's all I can say. You've got 2 weeks left. This is like your time to really hunker down, get your head in those notes, start doing your active recall, speaking it out loud, things like that. Don't don't get distracted. If you've got distractions going on, leave the distractions, tell the distraction to leave. I had an ex that would drive me insane when I was studying for my TEAS exam, and they were basically like, "You're going to choose me or you're going to choose that." I chose my TEAS exam because I wanted a better life and I didn't want to end up like that loser. So get rid of the distractions. Get rid of it or go someplace else so you're not distracted. You just, unfortunately, you just have to like just zone into what it is that you need to be doing in that moment. Is that why you teach? Oh, the reason I teach is because nobody else is teaching you, right? So if you think about it, for those of you who are like wanting to go into nursing school, or even for those of you who have done your prerequisites, did your professors really teach you anything? I mean, all of them. Let's just say a majority of them. Did 90% of your teachers actually teach you anything? No, right? They were basically like, it's in the book. It's in the book. Did you read the book? It's in the book. If I have to hear that sentence one more time, I'm going to lose my mind because the whole point of me paying for this class or me paying for this program, which is exorbitantly expensive, is because I'm expecting that you are going to teach me the tools and things that I need to know in order to be successful. The system is failing us, y'all. It is. They're not teaching you the things you need to know. They're trying to either over teach you and be so academic that it's so confusing you don't even know what to question, or they're under teaching you to the point that they're just doing the bare minimum in order to get the paycheck and go home. And that's the whole reason that I started doing what I was doing, is because my professors weren't teaching me. And whenever I would have questions, the biggest thing I got every single time was, it's in the book. Or you should already know this. You've already taken a class and passed it. Yeah, but that professor also didn't teach. So that's the whole reason why I teach and why I do what I do, is because I don't want you all to go through what I went through and not really understanding concepts and getting into a career where you're like, I don't know what I'm doing because nobody ever taught me how to be successful. So no, my whole thing is, it's all about teaching concepts and you understanding the concepts so that you can be successful and feel more confident when it comes to your exams. So yeah, that's the whole reason I teach, because I've been there. I've been there. I laugh really hard about your statement about your ex driving you crazy at the exam time. I'm telling you, man.
Someone. Oh, actually, I think I try to avoid that question.
What?
But since you're on that topic,
Sure.
someone asked, "Is it common people get divorced in nursing school?"
Let's talk about it.
I try to avoid this as long as I can.
This is a great question. This is a great question. What are you talking about? So here's the deal. Let's talk about it. So the question was, is it common for people to get a divorce or breakup in nursing school? 100%. You know why? It's because people are insecure. People are insecure. Let me tell you something. When I first started nursing school, I broke up with my ex. We literally just talked about it. Because that man was so insecure that I wasn't spending enough time with him and he felt alone. Get out of my face. Okay? I'm trying to better our lives by me having a career where I can actually make money and make something of myself. And you're impeding me from being able to do that. So does those conversations take place? Absolutely. Because at the end of the day, let's be honest, some of us got with partners that were insecure. And it only made it worse when you stop giving them time because you're doing something for you. Right? We've got some narcissistic, insecure, uncompassionate individuals out there, male and female. Doesn't matter what it is, right? It is what it is. So will people get divorced or end up in broken relationships in the beginning of nursing school? 100%. 100%. What you really need to watch out for, though, is those individuals who try to get you at the end of nursing school. Because what happens is a lot of us try to date during nursing school. Let's be honest. Nursing school can be very lonely, right? Some of us need to release some stress. Some of us just need a little something, something on the side so that we're not losing our mind as we're going through this program, right? Those people sometimes, not all the times, but sometimes are opportunistic people, meaning that they see, oh, Shorty about to finish school and make bank. And I'm about to sit on the couch and not have to do anything for the rest of my life. There's some of them out there, not all of them. Mr. Cheung wasn't one of them. He's still with me and he still does a lot of things, but there are some of them out there, right? So you have to be able to shift through who the good people are and who are the opportunistic people are, right? So will you lose people at the beginning of your program? 100%. But those are people you shouldn't have been with probably in the first place anyways, right? Will you have to be careful about who you end up with once it's all over? 100%, because they're going to look at you like a paycheck and they're going to look at you as a free payday. So I had one guy in nursing school towards the end. He told me we went on one date, right? The second date that we went out on, he told me I needed to start helping him pay his rent. Mind you, I don't live with him. Never even seen his house. Told me I had to start paying his rent if we were going to continue dating. Half of it. And I said, are we moving in together? Like, I don't understand why I'm paying your rent. And he's like, no. I just need you to pay half my rent.
If someone asked you met Mr. Chung when you were about to graduate, yes, no.
No, I didn't meet Mr. Cheung when I was about to graduate, but I met him on Match.com several years later.
And I make more money.
And he made more money than me
I am the
at the
sugar
time.
daddy.
At the time. But yeah, the audacity of that man to see me as an opportunity and to be like, no, I need you to pay half my rent if we're going to continue dating. Well, then let's just end this here. I'm good. I don't need you. I can pay for myself. But yeah, let me tell you, you're going to break up in the beginning. You're going to have opportunistic butt heads at the end. It's the natural progression of nursing. It's going to happen. People are going to look at you and be like, oh,
Ching-ching.
cha-ching. Don't, ladies and gentlemen, don't end up with like lazy people. Don't end up with lazy people. Make sure they have a job and stuff first. We're too good now. We have degrees. What did he say that? What did he say after you said that to him? He was basically like flabbergasted that I would even consider not paying him. It was a very awkward conversation. Thankfully, back then, I didn't allow people to drive me to dates. Like they'd be like, "Let me come pick you up." Nah, I'm good. Where are we meeting? I'll come meet you there. But that would have been an awkward drive if I had. But he was just like, it was the audacity of that man. He thought, "Oh, well, I'm the gift from God, and you should have to pay half my rent." Nah. What was the craziest relationship stories between you two?
Oh, definitely not Chung. I was a good boy. I am a good boy. Very good.
I ended up with all the jerks. I'm going to be honest. Mr. Chung didn't date a whole lot when we eventually got together. Like, he wasn't a dating guy. He was more of like, I'm going to work my butt off kind of guy. Nurse Chung was a hoe. Nurse Chung dated everybody. Everybody. I met Mr. Chung and I stopped. I stopped my whole ways. But up until that point, because see, Nurse Chung just wanted some love, right? Nurse Chung was lonely. Nurse Chung was like, I just want a nice man, a lasting relationship. Apparently being a hoe isn't the answer to find that. Yeah.
What does CCRN stand for?
CCR stands for Critical Care Registered Nurse. It's a certification you typically get after being in the critical care area for at least 2 years. You can sit for the certification. I did. I found my donut. I'm about to start nursing school. Any advice? I'm nervous. Great question. First of all, being nervous to start nursing school, completely normal. The way that you feel about that. Um, my biggest advice to you, time management, get you in a good planner. You're going to have to get a really good planner with all the days. You're going to have to write out all of your stuff, when your assignments are due, when your classes are, when you've got tests, when you've got simulations, when you got clinicals, write it all out. Because that way you can see what you've got coming up and what you really need to be focusing on. Number 2 is organization. You have got to have your stuff organized because they're going to ask you for all kinds of stuff when you're in nursing school, especially getting started. They're going to ask you about titers, background checks, urine tests. Like you're going to have like a whole bunch, BLS certification, different vaccinations if you haven't had them. Like you're going to have a lot of things. You've got to be very organized. Studying wise, before going into school, what do you need to know? A&P is key. If you do not know your A&P, you have got to know it now because they will not teach you. They will not teach you when you're in school. So you really got to know your A&P. I would start learning your medical med math dosage calculations because that's going to be huge. You have to get 100% on your med math in order to be able to continue in the program. You cannot, even if you miss one, it's your automatic fail. You have to get 100% right in order to continue. They will drop you from the program if you can't pass that test. And know your medical terminology because that's going to be key with breaking down what things are and what's actually going on. And it'll help you with like your A&P and things like that. Those are my big key things for like new nursing students. Yeah, Mr. Cheung was very innocent. Nurse Cheung was like, not at all. What you see is what you get. I mean, if you ever see me in person or whatever, like this is who I am. But yeah, Nurse Chung had a phase, y'all. I'm not the only one in here that was a hoe. I can almost guarantee you that I'm not the only one in here that went through that phase. Guarantee it. 100%. Some of y'all might not want to admit it, and that's cool. We can keep that secret. That can be between you and me. But I'm just saying that some of y'all went through it. I'm not the only one. Oh, good, Dana. I'm rewatching your A&P videos before I start the program. Good. That'll be helpful. That'll be helpful. How all the programs go around. Do I have to know A&P in depth? Yes. You need to know what the structure of A&P is, how the particular system works, how it functions. How does it function with other systems when things go wrong, right? How do they function normally? Like you have to know the ins and out of how A&P works. If you can understand that, and then you can understand how the disease process is affecting that, then you will understand how it affects that system plus other systems down the line. So that's why it's so important to really have a good in-depth knowledge of A&P. What method of study would I recommend for nursing school? For nursing school, my biggest thing, honestly, for pretty much all of your classes is going to be active recall. 110%. The more that you can do active recall, the better off you will be. Meaning that instead of just reading your notes, if you're like me, if I'm reading, I get ADHD and then my mind wanders off. So I literally have to get a blank sheet of paper, a whiteboard, whatever it looks like, and I'm literally writing down my notes and speaking it and teaching it out loud. And then at the end of the day, once I'm done with that, whatever I've missed, that's the stuff that I need to study. That's the stuff that I need to go back over again. So yeah, so that's my biggest recommendation is to really like speak your notes out loud, really understand concepts and why they are happening because you've got to build up that critical thinking in nursing school in order to stay ahead of the game. Is the dosage calculation test every semester? Or when does the test come? So it depends on the school, Sandy. So dosage calculation for me when I was going through nursing school was when I took pharmacology. So pharmacology for me was a separate class. It still is for some schools, not every school, but if you have pharmacology as a separate class, that is when you will take dosage calculation. If you were going to a school where they mix in pharmacology, then I don't know specifically when that test will come or if they will test you every semester. But there is going to be at least one time that you're going to have to take that test and pass it. 100%. Do you think CNA experience really helps us as a nurse? This is like a controversial topic. So, because I had mentioned before that I personally think that every person that is wanting to get into the healthcare field, either LPN, RN, some kind of bedside role, should be a assistive nursing personnel, whether it's a CNA, PCT, nurse technician, whatever it looks like at some point before they start that role. That's my personal opinion. Now, there's a bunch of creators on here because I was watching some other creators' lives, and they're basically in the realm of saying, no, you don't have to be a CNA. I don't think CNA really helps you with understanding the nursing role. I agree with that and I don't agree with that. I don't think that it prepares you to actually like be in the RN LPN role, but I do think that it provides you with a vision of what the CNA role is, because as an RN or an LPN, you are going to delegate. So sometimes you're going to be delegating to those roles. It's good to, number one, know what the roles are and what you can delegate to them. And number two, it also helps you appreciate your CNAs, your PCTs, your nurse technicians. It's going to help with that, right? Tremendously. Because personally, I appreciated my CNAs so much more having been a patient care technician while I was in nursing school than if I hadn't done it, because I know what they go through and I know where they've been. And let me tell y'all something. CNA roles now, PCT, whatever you want to call them, depending on their education, is very different than what it was when I was in that role. So when I was in that role, I had like an 8 patient max at night. So basically, I had 2 nurses that I would work with. Both of them would have 4 patients each, and that was who I had. Now, your CNAs are having like 10, 12, 20 plus patients, right, on the unit, and they're having to provide a lot of care to those individuals. So that's why it's so important personally that you've experienced it at least at some point in your career. Personally, when I was a bedside nurse, I had my RNs and my LPNs work one shift with the CNA just so that they could get a feel of like what it's like in that role. So they just learn to appreciate. They learn to appreciate our CNAs more. So big controversy regarding it. I know there's a lot of creators out there that will go back and forth about, no, you don't need to be a CNA. I personally think that it's worth it. Just so that you can gain perspective about what the role is and also compassion for the individuals who are doing it.
As a new grad getting off orientation in a week, what do he or she need?
As a new graduate getting off orientation in a week, what do I think that you need? Um, Here's the number one thing that I'm going to tell you. When you come off orientation, you're not going to feel ready. That's number one. Nobody has ever come off orientation and has been like, I'm good, right? Nobody's done that. I've had one person do that, but then they ended up not working on our unit anymore because they didn't they weren't grasping how difficult nursing is. And they ended up harming a patient, but we're not going to go there. So number one, you're never going to feel ready when you come off orientation. Know who your people are. So know who's really good at IVs, know who you can go to, like your charge nurse or other nurses that are like your information centers with things that you don't know. Know that when you come off orientation, your first couple shifts, you're going to be kind of like a fish out of water, because now you're the nurse. You're the one doing all the assessments. You're doing all the charting. You're doing all the medication passes. You're not going to have that person that's going to be that support center with you all the time. So know that what you feel is completely normal. Know that it's going to take you 6 months to a year before you even feel comfortable on the unit. That's just common when it comes to nursing. All I can say is try your best. Take it one day at a time. Don't let a shift make or break you when it comes to being a new graduate. It's just that if you have a crappy shift, just acknowledge it. I had a really crappy shift, but my next shift is going to be better, right? And just keep pushing because it gets better, I promise. It's just scary in the beginning, especially when you're on your own. So not particularly a fan of MSN-DE programs. What do you mean? Like direct entry MSN programs? It's not that I'm not a fan of them. I think that they're fine. I think it's just depending on like what it is that you want to do. I think that here's my deal. I think that everybody's trying to make nursing either super easy or super fast, right? Because we're living in an age where we get things super quick. Like we're very like we need instant gratification in order to feel satisfied, right? So with that comes certain things like making things easy, making things fast so that we can get to like the end point quicker because we don't want to have to spend a whole lot of time, in a 2-year program, like for an associate's, right? If I can do it in like a year or year and a half. That's the whole thing. I don't like that everything is becoming so quick because as working as an educator, because I still work at the not bedside, but I still work in education, y'all. Working as an educator, I see not everybody, right? There's still some people that come out the other side that do fantastic, but there is a percentage of the population who goes through these like very quick accelerated programs that are very lost, very confused, and end up leaving the profession because they don't feel prepared. So that's the whole reason why I'm kind of like, when it comes to accelerated programs or direct entry programs where you're doing like associates and then bachelor's and then like your master's, like boom, 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 boom. It's just happening too quick. Right. And I personally feel like, especially if you're wanting to do a master's degree in nurse practitioner or CRNA, that there is this thing with experience that makes those degrees so much easier. And gives you the experience about like being compassionate to patients and like how to actually respond in emergencies and how to care for a patient load and knowing the resources that are available. There's just something that comes with actually working and experiencing it that's going to help you when you want to become an NP or a CRNA later. By just completely negating that piece and not actually working and experiencing that role, it's just going to be very hard to acclimate, right? There's just something that comes with experience that no program is going to give you. You just have to experience it. So that's why I'm kind of like, with accelerated programs as well as direct entry master's programs, just because sometimes you miss out on those important pieces. Hi, Bianca. Oh, good. I'm glad you liked the video. I get so much pushback on staying through, but I'm 50 when I get my, I'll be 50 when I get my MSN. I get so much pushback on staying through.
Oh, so she is 49 when she will be going to be 49 when she is walk for her BSN RN.
Okay.
And when she's trying to go for her MSN will be 50.
That's okay.
I guess because like the people that she talked to push back. Like you shouldn't go, you're 50 now, why you want to be
Oh, first of all, screw those people. First of all, okay. Now I understand what's happening. So here's the deal. Whether you are 50, 65, 105, it doesn't matter, right? People always have an opinion. You know what I'm saying? Like everybody's got an opinion, just like everybody has a butthole, right? At the end of the day. It is what, but seriously, like everybody's got an opinion, everybody's got a butthole. Like that's really what I think about opinions. Like I appreciate feedback, but when you basically are giving me an unconstructive opinion about, oh, well, you're going to be 50, like you really want to like continue with school, why not? my very good friend before she passed away that I went to nursing school with, she was 65 when she started nursing school. And the only reason that she started was because she wanted her kids to grow up and she helped raise her grandkids. Once her grandkids were of age, she went back to school. She became an RN and she worked as an RN for a period of time before she ended up passing away. But age is just a number, right? Like, whether you want to do it now or do it later or do it when you're 20, 30, 40, 50, 60, 70, who cares? Right? Like, it's your life. Nobody's going to live your life except you. So at the end of the day, if that has always been your goal and that's something that you wanted to do, forget the haters. That's the thing. That's like people when they have opinions have like unresolved issues about things that they wanted to do. Right? Well, I always wanted to be a marine biologist. I don't know. I'm just coming up with something. So then they take it out on you and they're like, well, why would you want to do that? I don't need your opinion. I'm good. Have a nice day. Thanks for coming. Don't let anybody tell you what to do and what not to do. It's none of their business. Thank you.
Yeah, there you
That's
go.
the word I was trying to get out, but it wouldn't come out.
So someone asked if they have a bachelor degree in another area and want to get into nursing, will accelerated pathway be a good choice?
Can you do an accelerated program already having a bachelor's degree? Would it be a good choice? I mean, can you do it? Absolutely. Do I recommend to do it? Not really. Just because of the fact that, and I hate to say this, I'm like coming off as like an accelerated hater, but it's just like, I just feel like people that go through accelerated programs are putting themselves at a disadvantage by doing accelerated programs. I mean, we had people in our traditional associate program that already had their master's degree and were just going the traditional route because they recognized that accelerated wasn't for them and they just weren't learning anything in the accelerated program. So, will some people thrive in an accelerated environment? Absolutely. But it's just that you're learning things at a very fast pace and it's hard to retain any of that information. So, I don't know.
And it depends on what major. That's the biggest thing.
I
Like
don't
for
even care
me,
what the major is.
for me, I have nothing on science,
Yeah.
then I will struggle a lot compared to if you're like a little sciencey topic major ish.
I think the
Very
problem
easy.
is that like in general, like you're also learning like a different way to write papers and like it's just like it's a number of things that just put you at a disadvantage and that's why I'm like,
Sure.
so I don't know. Do you think it's worth to go back to be an NP? Here's the deal. If you want to be a nurse practitioner, there's absolutely nothing wrong with that. I would say go for it if that's something that you're wanting to do. Just know that initially, coming out of the other side, you may not make as much as you did as a seasoned nurse. That's pretty much been the theme when it comes to nurse practitioners coming out of school is that the pay is going to look a little bit different. Will you eventually get more money? Absolutely. Um, but just know that that comes with a lot of stress because now you're no longer reaching out to the provider, you are the provider. So you also have to take that into consideration. That's why a lot of nurse practitioners burn out very quickly is because initially it's just like as nurses we're like let the provider handle it. Like what do you want from me? I'm going to provide what you tell me to do as long as it's within reason, but like let the provider handle it. Now you are the provider. So you have to come up with the solutions. So if you're good with that, you're going to be fine. But there's nothing wrong with NP as well as CRNA. The only thing that's going to make CRNA hard now is because of the changes in the financial aid structure. CRNA schools are really expensive. They're like $200,000, $250,000 depending on like where you go, sometimes less, sometimes more. So it's going to be a little bit more difficult to pay for them, but there's nothing wrong with either career. I think they're great.
Yeah, someone just say they learn pharmacology on Monday and then have a test on Tuesday on the accelerated program.
Yeah.
That's what the comment.
So somebody said that in an accelerated program, they learned pharmacology on Monday and then they had a test Tuesday. I personally really like my mental health, and I feel like that's a really hard pill to swallow when you're just like literally flying through these classes. It's just, it's hard. Am I a nursing educator? I am. I'm a nursing educator for the CVICU and ER areas. I also do corporate nursing education where we bring in graduate nurses, seasoned nurses that are going into more intensive acuities and need that additional education to be successful. So, yeah, I do all that. Nurse Cheung, you should have a career mentor plans and help us find jobs if we earn money and could pay the fee. That would be fun.
Someone asked, what's the thought on EKG tech for like before school, early school?
I don't think that there's anything wrong with being EKG tech, but I will tell you that something actually came out about that recently that kind of threw me off. So, some hospitals, not all of them, but some hospitals are actually getting rid of their EKG techs and they're assigning EKG, like 12 lead responsibility to their respiratory therapists and something else. I can't remember what it is. It's like RT and something else, which is crazy to me. Not that RT doesn't have enough to do. I mean, they're handling ventilators and all of these treatments and, BiPAP machines and just like, I mean, just all kinds of stuff. Like RTs have all kinds of stuff that they do. Let's add EKG to it. So I'm not 100% sure. This is like a recent thing that I heard about. Like one hospital system particularly, like with several hospitals are making that transition. So if you have a hospital that has an EKG tech role, that's fantastic. I think it's great. You're going to learn a lot as an EKG tech of what to look for. You're going to see things over and over and over again that you're going to be like, oh, this is bad. So you're already going in with good EKG knowledge. But before you start school, yeah, absolutely. But yeah, I heard about that. That was insane to me. I was like, let's just keep piling on somebody who's already overwhelmed as it is.
So someone is curious on what type of nurse educator you could be as a nurse.
You can be any kind of nurse educator. There's nursing education for everything. I mean, any specialty, they've got nursing educators. If you're wanting to do corporate education, you can do that. If you're wanting to do like specialty, like ICU, PCU, med surge, like not like specific things like CVICU, neuro ICU, but like just the generalized specialties, you can also do that. Honestly, there's so many different kinds of nursing educators out there. You could be a school educator. You could go back and do that if you're wanting to do. I mean, just so much, so much. There's a plethora of things.
Someone is in PCU and felt overwhelmed 3 months in. CTS and HF, now lung transplant. She don't feel like belong.
Where is it at? Because I want to read that.
Tick, tick.
Is it up a little bit?
No, at the end. Magazine. Yep. The second
Oh, I'm a PCU. I'm in PCU. I feel overwhelmed 3 months in. CTS and heart failure, now lung transplants. I feel like I don't belong. This is what I will tell you. PCU is not what it used to be. Not what it used to be. And I can almost guarantee you, Mags, you probably have a high patient ratio too. So not only are you dealing with, all of these different things with heart failure and lung transplants and things like that, you're probably also stretched thin with the resources that you have available to you. The patient load, your patient or nurse patient ratio is probably crazy too. Yeah, see, 4-to-5-to-1 ratio, that's insane, right? That's insane, especially with dealing with patients like that. This is what I would say. If you don't feel like you belong, there's probably a number of reasons why you feel that way. And the first time that happened to me was when I was in orthopedic med surge and I was on nights. And though I loved my team because that was like my dream team, right? When it came to being a nurse and being like one of my first jobs that I had, I didn't feel like I belonged, right? Because I didn't really care about, closed reductions, open reductions, knee replacement, hip replacement, shoulder replacements. I didn't really care about any of that stuff. Did I know how to take care of those patient populations? 100%. But was that going to be my end goal? Absolutely not. And when you start to have those feelings, it's okay to say, you know what? This isn't for me. I might want to try to find something else, right? Even with just being 3 months in, right? Like 3 months doesn't feel like a lot of time. But if your heart's not in it, it's okay to be like, you know what? This isn't for me. And you can absolutely find a new career and a new position because now you have experience, right? Which is what a lot of people lack. And you can do anything because nursing in general, there's just so much that you can do. You can literally do anything. So, my biggest advice to you is if you are feeling that way, sit down, do an assessment. What are the pros of staying in this situation? What are the cons of staying in this situation? And if the cons outweigh the pros, it's okay to be like, you know what? I want to find a different position. That's what I did. I found the ER and I loved it. I stayed in it for 5 years. Loved it. Advisors are saying I can't work full time and do nursing school. They're making it sound impossible. Nursing school and working full time is very difficult. So I understand where the advisors are coming from because I worked full time night shift and I worked and I did nursing school full time. So it was very difficult for me, one, because I didn't have a flexible manager. They were unwilling to work with my schedule. They were basically like, you work when we tell you to work. Um, and it just makes it hard because if you think about it, nursing school, you're going to have a lot of stuff going on. You're going to have not just classes, you're going to have simulations, you're going to have simulation checkoffs, you're going to have clinicals that you're going to have to attend, you're going to have testing assignments, regular assignments, study time. I mean, the things that you're going to have to do are going to be endless. So that's why it's really, really, really hard to work while you're in nursing school. It's not unfeasible to do it, but you just have to know that you're going to have a lot of sleepless nights trying to catch up and staying on top of everything. And if you have a manager that's willing to work with you and your schedule, it may make it a little bit easier. But yeah, it's going to be really hard to work while you're in nursing school. You just have to like go in knowing that it's going to be difficult. You're welcome. Yeah, it is really hard to have a job and be in school too. I It was very hard for me. I ended up having to leave. I stayed in that position for like 2 months and then I said I can't do this. I can't do this anymore. I'm in my 29th year. My LPN was cool. At 48, LPN BSN accelerated. It feels crazy. Yeah. Yeah. Any kind of accelerated program, it's like, it's mind blowing how much you're supposed to learn in a short period of time and still be successful in the program. That's why I'm just not a huge fan of accelerated programs. I tried working. Oh, I missed it. uh, I started nursing school January. That's congrats, Adore. That's great. Welcome to chaos. It is nursing school. It's gonna be a little bit crazy in the beginning, but just know, like, once you get your feet underneath you, you're gonna be just fine. You are gonna be just fine. It just takes a minute. It just takes a minute. What were clinicals like? Ooh, let's talk about it. So, clinicals in nursing school, depending on the clinicals that you're doing, it's going to be a little bit different. So, fundamentals clinicals, when I started, were more like nursing home type of clinicals for me. That's just my personal experience. But my fundamental clinicals were nursing home. So, we were basically taking care of individuals that were in a skilled nursing facility, meaning that they needed around the clock care. A lot of them were bed bound. Um, a very kind older population. That's where we started a clinical. And then when I got into medical surgical, then we started getting into more of the hospital environment where we were doing med surge. So those are more of a patient population that are there maybe for observational reasons, that they don't necessarily qualify for the more higher acuity units, but it's really just trying to get us prepared to do more clinical assessments, how to care for a patient team, see different kind of procedures as they come up. That's pretty much what your med surge piece is. When you do mental health, my mental health was in a locked down facility. It was not inside the hospital. We were at a separate location where they took little bit more of the higher risk patients too, where a lot of them were locked in their rooms. The less like higher risk patients were able to like kind of go outside and go and do like community time in the middle of the room. I mean, more a lot of different patient things with like schizophrenia, bipolar, um, multiple personality disorders, like things like that. You see a lot of that. So that was what I did for mental health. Then for pediatrics, I was back in the hospital setting working on a pediatric unit. Mother baby, that's where we were doing like labor and delivery. We were like in antepartum, postpartum, all of those types of things. And then for my practicum, I actually did my practicum in the ER, clinical wise, but you're going to see a lot. That's why I'm like a huge proponent of doing a traditional nursing program, because then you get a lot of exposure to things that you may not have necessarily gotten exposure to initially, in an accelerated program. I feel like a lot of people later on in their life realize that they want to be nurses. I agree, Noy. I think that it's like you kind of get into a career and then you're kind of like, I'm not sure I want to continue doing this. And then people get into nursing, one for job flexibility, but also stability, right? And the money wise, monetary wise, a lot of like nursing jobs pay way more than what people were initially making for sure. What school did I attend? I personally attended Seminole State College of Florida, and I did a concurrent program at the University of Central Florida, so UCF. So I did my bachelor's degree. I kind of did like an accelerated program, for lack of a better word, but I did my bachelor's degree in a matter of 2.5 years as opposed to 4. But my associate's program was at the regular associate's pace. So I did my associate's program for 2 years. I did my bachelor's program on top of my associate's program while I was in the school. And then my last semester after I got my RN license, I finished my last semester of my BSN and then moved on. But I basically like the bachelor's and the associates were both at regular pace. It was just that I was doing them at the exact same time. It wasn't like where you have like you were getting lectured on Monday and then I had a test on Tuesday. It wasn't anything like that. What do I think about being a nurse at Walt Disney World? I think it's great. I think that, hey, if you can get a position, they're very hard to get because a lot of people really want them for the benefits and the things that they provide. But I don't think there's anything wrong with that. I mean, you're basically a first aid station, so it's good to have like some kind of emergency experience if you can have it. Just to know like what to do in emergencies. Even ICU, honestly, probably would be a really good situation. PCU. But if you have the experience and they accept you, I think it's fantastic. Tips for getting manual blood pressure down. That's a great question. Make sure that the cuff is on the right way and that the sphygmometer is facing you so that you can actually see. When it comes to manual blood pressure, it's like practice makes perfect. So if you have a parent, a significant other, a sibling, put the cuff on them and pump it up. Once you can't hear the heart rate anymore, that's when you stop pumping, right? Don't like go up to 200 or 180 or something. Like just go into the point where you can't hear the heart rate anymore and then start to release it slowly. That releasing the pressure takes a little bit of work initially. Took me a little while to figure it out. Sometimes I released it too quick and then I didn't have enough time. But release it slowly. Remember, when you start to hear the heart or the pumping, the blub dub blub dub blub dub, that's your top number. That's your systolic number. And then once you can no longer hear it, that's your bottom number. That's your diastolic number. But I'll tell you that like skills like that, practice makes perfect. You just have to keep doing it over and over and over again. You really got to find yourself somebody that is willing to let you be their guinea pig. I always wanted to be a nurse when I'm scared of school. Don't be scared of school. School will not teach you the stuff that you'll need to know. A lot of it's going to be self-learning, but I think that you're going to do amazing. I'm not worried about it whatsoever. You have to find your flow. You have to find what works best for you. And hopefully I'll have videos coming out that'll help you actually learn concepts and not just like trying to figure it out.
Any tips for new grad trying to get into a residency program?
Any tips for new graduates that are trying to get into a residency program? So, this is my first thing when it comes to finding a job is that if you are wanting to do a certain thing like ER, ICU, whatever it looks like, try to find a RN residency job in that position, right? ER, ICU, whatever it looks like. However, if you are applying to those positions and you're having a little bit of a difficult time, then you need to do a little bit of reevaluation about how to get started. Because here's the deal. The number one thing I get constantly from people who reach out to me is they say, "Hey, I really want to work in ICU and I just can't find any RN residency positions." And I usually ask, like, have you interviewed? Has anybody called you back? And a lot of times, like, they either haven't been getting phone calls back. So that means it could be a resume issue, right? It could be that your resume needs to be updated, needs to be a little bit more professional. Or two, they got a call back, they went in for an interview, but they didn't get the position. So that means it's an interview issue, right? So we have to figure out where the issue lies and how to fix it. If you're not getting phone calls back, it's the resume issue. We need to fix the resume. If you're getting phone calls back and you're interviewing, but you're not getting the position, it's an interview issue, and we need to fix how you interview. Now, the other thing that you need to consider is that a lot of people will tell me, "I can't find any positions. I've applied for everything." And I say, "Well, what have you applied for?" "Oh, I've only been applying for ICU positions because that's what I want to do." Sometimes you may have to work on a lower acuity in order to get experience and then transition upwards later on, meaning that a lot of times these higher acuities like ICU, ERs, things like that, they want to see that you already have experience so that they're not teaching you like the basic of the basic. They're just teaching you specific things that you need to know for that position. So sometimes, like me, because I wasn't able to get an ER position initially, I had to work in orthopedic med surg. There's nothing wrong with that. I can't stand when creators are like, "Don't accept any position unless the position that you want." Sometimes feasibly, it's unrealistic, right? Because you're just trying to get a position just to get started. And sometimes those positions either aren't available because they've already hired for them, or they are available and maybe it's a resume or it's an interview issue. So that's why I always say there's nothing wrong with starting at a lower acuity. If you're wanting to do ICU and a PCU offers you a position, that's okay, right? If you're wanting to do PCU and med surg offers you a position, it's okay to start on med surg. There's nothing wrong with that. There's nothing wrong with starting on a lower acuity and working your way up. Sometimes it's just not feasible to get into certain things initially. Labor and delivery and NICU, very hard to get a new RN grad position there. So if it is specifically in regards to like getting phone calls back, you could look at the resume. If it's the interview, you might have to reevaluate your interviewing. And if you're just not finding anything, it's okay to start on a lower acuity and work your way up. It doesn't make you any less of a nurse if you didn't get into the position you initially wanted to. It's just a stepping stone, and that's okay. Get your experience and then get your ICU position. They will take you open arms because you already have experience. How many classes did you have at once while a nursing student and while working? So I think the most I ever had at once was 4 classes. That was my first semester. I was taking fundamental pharmacology, and then I had a health assessment in my bachelor's program, and it was like a writing course. I can't remember specifically what it was, but it was like teaching us how to write with APA format. So I had 4. But traditionally, with doing what I did, I didn't have more than 2 classes at a time after that. 2 classes at a time after that. It was just that first semester was horrible. I almost failed. It was bad. Yep, small steps towards up the stairs. You've got it. Piece by piece. I want to be a flight trauma nurse. Ooh, get in the ER. Get in the ER, get your emergency stuff going, right? Get that experience in and work your way, especially if you want to do flight trauma, get into a level 1 trauma ER if you possibly can. That'll be huge for you. That'll help a lot. Is RN a good job for a shy person, slightly social? So here's what I'm going to tell you. While I'm very expressive when I'm online, I'm a huge introvert. Mr. Chung will tell you is I'm very like if I get into crowds, I get super quiet. Because for some reason I get socially awkward and I hate it because like somebody will tell me a sad story and then I'll laugh and it's not because it's not because I'm like this because of the story, it's because I'm uncomfortable because I'm in a crowd, right? So I don't know how to emotionally express myself when I'm having difficult conversations. So sometimes I cry or I laugh and it's just because it's just an emotion, it's a weird emotional response that I have. So I tend to be much more introverted. um in general, even though I seem very like extroverted because of what I do online and how I teach, if I'm in like front of like a group of people and I'm teaching, I am the most extroverted person you will see. But if I'm not like the center of attention, I become a very introverted person and I become like socially awkward. It's the most insane thing. So, will you make it as an RN? Yes, you will make it as an RN. I I'll tell you my funny story. When I first became an RN, the doctor was in the room explaining to the patient that they had cancer, right? So they had done this like whole procedure, they had done this like knee thing, and they ended up finding bone cancer. And I had never experienced that. And the patient was crying, and I started crying. And I didn't know what to do because I was like terrified as a new graduate nurse. I was like, how do I respond to this? Because the doctor just left the room. And it was just me. And I started crying. And honestly, that was probably the best response to have was to be emotional with the patient, even though they tell you not to. I think that crying with the patient, experiencing those emotions are really powerful. But it's just like, it's the point that like normally people would be like, why are you crying? Like, I didn't know what to do. I was in an awkward situation. So yeah, I do like, if you ever meet me and I laugh at the wrong thing or like I'm like socially weird, just know that it's me because I'm like awkward. I don't know why I'm like that. Why are you making that face?
Huh?
Huh? Why are you making that face?
I'm not making that. That face is so.
I saw your eyebrows.
That face, your face is so.
Mr. Chung went like this with his eyebrows because he knows that's what I do. It's very weird. But you're gonna be fine. You're gonna be fine. Initially, it's gonna be very awkward. The first time you have to knock on a door and walk into a patient's room and be like, "Hi, my name's so and so, and I'm gonna be your nurse today." It's gonna be the most. It's gonna be so weird. It's gonna be the most crazy thing, right? But just know that it comes easier. The more that you do it, the better off you'll be. I have a nervous laugh too. Yeah, we've all been there. We've all been there. I'm so socially awkward. It's crazy. I had somebody recognize my voice in the hospital.
Oh, yeah.
And remember that?
You don't know what to do.
And I was like, and I assumed because I had worked at the hospital that that's how they knew me. I was like, oh, well, I worked down in CVICU. Maybe we ran across each other. And she was like, no, no, no. Because this was back when we were still wearing masks. This was back when COVID was still happening. And I and I was like, well, I don't know how else you would know me. And she kept staring at me and I was like, I felt so awkward. And then all of a sudden she like found me in the hallway and she was like, I know you. And I'm like, and it like freaked me out. I didn't know what to do. And she was like, you're Nurse Chung. You taught me BLS online. That's how I passed my BLS. And I was like, oh,
Okay.
nice to meet you. It was so weird. It was just know that if you meet me and it's very awkward, it's not you, it's me. You have a heart of gold. I really love everybody and I love what I do. It's just I'm so socially awkward. It just doesn't come across that way when we do these lives. But yeah. Yes, I did find a perfect husband to support me. But she was fantastic. We took pictures together. We talked for a little bit. It was just that initially I didn't know what to do. So I got scared.
And then after that, what you do? You go find a bathroom and go pee.
Did I?
Yeah.
Oh, I don't even remember.
We immediately go find a bathroom because.
I was like, I think I peed myself a little bit because I was scared. It was crazy. I didn't know what to do. And it's not like nobody had ever recognized me before. It was just that moment I was terrified. After your associates, can you go straight to master's? Or do you have to get your BSN first? You definitely have to do your BSN. There are MSN programs where you can do your BSN first and then immediately go into the MSN program. But yes, you'll still have to get a bachelor's degree before you get your master's for sure. Do you think LVN to RN is a good path? Yeah, absolutely. Here's the deal. If you do like LPN or LVN and then decide that you want to do an RN later, do it, right? Life is short. Life is too short. If that's what you want to do, I say go for it. If a nurse doesn't have ACLS, are they allowed to push medications during a code? They shouldn't be. They shouldn't be. So typically, in order for you to be an ACLS provider, meaning that you are part of the ACLS pieces of a code, you would have to have an ACLS certification. So could you do chest compressions? Absolutely, because those all fall under the basic life support standards, not necessarily advanced cardiac life support, right? But can you be like a documenter, a pushing medications, leading the code, like things like that? Not really, because you have to have your ACLS in order to know what medications to give, how much to give, and when to give them, like what the process looks like during the code. So yeah, typically you have to have your ACLS provider. It's nice to see you here. We worked together a while ago. Oh, where? Where did we work together? You tell me where, and I'll tell you if I remember.
Someone start nursing school in January. What kind of tips before start?
Somebody starts nursing school in January. What kind of tips? My biggest tips for what to study before you start is going to be doing your A&P. I'm sorry, my brain like went numb for a second. Making sure you're doing A&P, really understanding your anatomy and physiology. That's going to be key. Making sure you're doing med math. That's going to be huge. Really understand that med math and begin that. Because you have to get 100% on that test in order to pass. Really know your medical terminology. That will help you with your A&P, and really work on time management and organization. Those are going to be the keys when it comes to starting school. MCO.
That's an airport.
Huh?
That's an airport.
Oh, I don't work in an airport. I'm like MCO.
Is it Orlando? Oh.
The city. Oh. Well, I've had a lot of jobs in Orlando.
I've had system you can think of.
Anything system you can think of, I worked at. I've worked at Advent. I worked at Orlando Health. I've worked at HCA. I've done a lot.
And even Halifax.
And well, Halifax technically is in Daytona.
But in general proximity.
I mean, it's Central Florida. If you want to consider it Central Florida, yeah. Orlando Health. Ooh, I've been there. Was it orthopedics? ER? I'm trying to think of where I worked. Orthopedics, ER.
ICU. Orlando Health, yeah.
Did I work in that? Oh, yeah, I was the educator there. PCU? Did I work in the PCU in Orlando? I don't remember.
No, I thought you just do the orthopedics over there.
Yeah, just orthopedics. Orthopedics was med surg. They made sure I knew that very well. What are your thoughts about HCA? I want to be a NICU nurse, and I see that they hire a lot there in NICU. So when they hire a lot in NICU, that means that they have a big turnover. So that's my biggest concern. Like HCA, here's the deal. I didn't really have any issues with HCA. I know that there's like this like tribe of people that are very like anti-HCA. But I worked at HCA hospitals. I worked at Central Florida Regional Hospital, which is now Lake Monroe, I think is what it's called. And I worked at Point Siena Medical Center, which was in Point Siena. Both HCA facilities. I personally didn't have any issues at either one of those facilities. I didn't feel like I was mistreated. I felt like I worked with a good team. Um, but again, I worked in like CVICU, so we were probably treated a little bit differently. Um, in those areas. So I don't know. I don't think that there's anything wrong with HCA personally. That's just my personal opinion. I haven't worked at a bad one yet. I know that there's a lot of people out there that are like, these are like bad ones, don't go here, but that's all hospital systems. There's even Orlando Health Systems and Advent Systems that people are like, don't work here. Right? That's all hospital systems. But I would just be a little bit concerned as to why they're hiring NICU nurses all the time. I think that would be what I would question.
What's your thought on applying for student nurse tech position in Advent?
I think that's great. So student nurse tech positions at Advent, typically you get those like towards like your later parts, right? So they have like a specific program. I don't know if they're still doing it. I think they might be. I don't know if Karen's still over that program. It's been a really long time, but student nurse tech positions are positions where you work as an SNT in various locations in the hospital, and you're basically working with a nurse. So you're not necessarily a nurse tech. You're actually just kind of like shadowing a nurse and helping them and figuring out what they do. So I think that if you were wanting to get a bird's eye view of a unit and how it actually runs and what the actual acuity is that you're providing care to, then I would say do it. I mean, it's only giving you exposure, number 1, and number 2, you're getting paid for it, right? So I would do it. What was my highest T score, if you don't mind my asking? Great question. I don't remember. I want to say it was like an 85 or 87. It was somewhere in between there.
But also, it's like
But it was also like 16 years ago. Because I've been a nurse for 14 years. So T's was very different back then than it is now, for sure. Just coming in, high turnover sucks. The problem persists, especially if they don't get rid of the real problem. It lasts forever. I 100% agree with that. I think that this is just, again, my personal opinion. Like I said, everybody who has a personal opinion is just basically like everybody having a bowl. But this is my personal opinion. So, healthcare, the reason why healthcare is failing, number 1 is because of ratios. Let's be fully transparent. We are still working in COVID ratios than pre-pandemic ratios. Not that pre-pandemic ratios weren't great, but now we're working with less and more people, right? So now I have a higher patient ratio, less resources, because a lot of hospital systems are like, well, we worked, these last 5 years with these ratios, let's keep going, right? And that's why a lot of nurses are experiencing extreme burnout. A lot of hospitals are trying to implement all of these programs that are basically trying to motivate nurses to continue working in these conditions, or trying to help them with mental health resources that are just non-transparent with a lot of these programs. You can't teach mental health through a continuing education. It just doesn't exist. And they preach a lot about like resiliency and things like that. But let's be honest, what is resiliency? Resiliency is the ability to return to baseline when you have reached a limit, right? So if I'm just constantly reaching this limit every single time I'm going into the unit, and I tell myself every time I leave in the morning, like, I hate this job, I don't want to go there, that's all burnout, right? That's all nursing burnout. And resiliency is never going to be achieved if we don't provide the resources and things that we need in healthcare in order for it to be achievable. So safer patient ratios, more support, getting rid of the problem that's causing a lot of the issue, right? Like, we've all got that one person on the unit that's driving everybody crazy. I'm sure that I'm not the only one that's been in that situation, or it's that manager on the unit, or it's that assistant nurse manager, or that educator, whatever it looks like. Keeping people in positions for way too long because we don't want to address the problem because there's this huge shortage happening in healthcare. That's what's affecting a lot of the system, right? So we can't fix it with pizza parties. And all of these things, like these warm thank you letters to your mass employees of your organization, like none of that works. None of that works. None of that fixes the issue. So, how do we fix the issue? We fix the issue what the issue actually is. I can't tell you as an educator how many times I got pulled in to meetings because let me tell y'all, education is not always fun. I got pulled into so many meetings about how do we make this work? And you basically tell them, "Hey, we need better staffing ratios. We need to go back to the way that it used to be. We need better resources for our nurses. We need to stop with these pizza parties and these like, oh, come take a picture downstairs because you're a hero, you're the nurse. Like, we need to stop with all that. That's not fixing the problem. You can't put a band-aid over a dam and expect that the band-aid is going to keep the water in. It just doesn't work that way. And how many times I got pushback from administration that was basically like, well, you just don't know how to address the problem. I just literally told you how to address the problem. So yes, burnout is very real in healthcare. Not all facilities are like that. There are some facilities that are still doing really good by their nurses, but unfortunately, they're few and far between now in comparison to most of them. So it's going to be a long road, y'all, because as nurses, we've been complaining about this for decades, not just like the last 5 years. This has been like a decades problem of things that have been going on. That's why like now you see like more and more nurses striking, right, at hospitals because they're trying to fight for better conditions. Like think about it. When you give a patient, and I'm talking about staffing ratios, when you give a nurse one additional patient, the mortality rates of patient care go up significantly, right? The mortality rates go up quite a bit, and the general population doesn't understand that. They don't understand that because they don't see what we do and they don't see like the hospital environment as a whole. They only see like what's going on in the moment. So when you provide a nurse with one additional patient, when you put them from a 5 to a 6 patient ratio, a 6 to 7, 7 to 8, whatever it looks like, even ICU 2 to 3, you're placing people at risk and you're putting your nurses in a continuous cycle of burnout, which is why we have this staffing shortage in the United States. Listen, y'all, there is no staffing shortage. And we're having a shortage of nurses who are willing to work in that environment. There's a ton of nurses out there that have left the career and went and did something else. If we go back to our safe patient ratios and the things that are going to make healthcare healthy, not just for patients, but also for the people who are working in it, we will see the nurses come back. We will see them come back. But unfortunately, we're just having to deal with like a whole bunch of crapola right now. And we're just shoveling it into a bucket to make it work.
So I have a good question.
What's the question?
Once you're burned out, is there a way to reverse it by still doing nursing but another position?
Yeah. So once you're burnt out, is there a way to reverse it by still doing nursing, but doing something else in nursing? Absolutely. Absolutely. I personally got burnt out in orthopedics and I was like, I can't do this anymore. Like I'm losing my mind. And then I went to the ER and it kind of gave me like a renewed sense of purpose. The same thing happened to me with bedside nursing. So I reached a point in bedside nursing where I was like, I don't know if I can continue doing this. I'm burning the candle at both ends. And then I was like, you know what? I always wanted to do education. Now would be the time to do it. Let's try. And that's what I did. I became a nursing educator and I've been in love with nursing education ever since. I'm not saying that nursing education is fantastic, right? I'm not saying that it doesn't come with its own set of issues and things like that, but it's much better. And I'm willing to accept those things as opposed to what I was allowing myself to accept before. So can we reverse burnout? I would say we're not going to 100% reverse it. I think that once you're burnt out, the burnout is always going to be there. It's going to take a very long time for you to become resilient and go back to baseline because that's just like very hard to get to baseline when it comes to healthcare, unless you find like a really soft nursing job that like meets what you need to be fulfilled, but also still gives you work-life balance, but I don't think that you'll ever completely reverse it. I think it's always going to kind of be there. You just have to find other ways to deal with it. And if it's finding another position, that might be one way to do it. But yeah, absolutely. All right, y'all. I didn't realize it's already 8:04.
Yeah.
Isn't that crazy?
Yeah.
Time went by so fast. All right, y'all. Well, thank you so much for coming. This has been great. Y'all had some really good questions. And honestly, we had some really good conversations about what's happening in healthcare right now and different ways of like fixing it and what not to fix and what to do when you're in school, what not to do when you're in school, how to handle the T's, all of that stuff. So I think that we had a really, really, really good night of conversation. So I'm going to leave it here. We will be back next Sunday. So if you had like additional questions that maybe I didn't have a chance to get to, definitely come back next Sunday and we'll get more into those questions. But we'll be back live tomorrow for my ATITs folks. We're going to be covering A and P on Monday.
Yeah,
Um,
that's very nice.
yep. And then on Tuesday, we're going to be covering English. And on Thursday, we'll be covering, I'm sorry, on Tuesday, we're going to cover reading. Sorry. And then on Thursday, we're going to be covering math. So if you are part of our Tees group, I hope that I see you all there. Otherwise, I hope you have a really good night. This was a fantastic night. I love that we had really like uncensored conversation about what's going on in healthcare and how I can help you be